This cadaveric image presents an in-depth view of the thyroid gland and its extensive vascular supply. The investing fascia, along with the sternohyoid and thyrohyoid muscles, has been carefully incised and reflected to reveal the thyroid gland in clear detail. An H-shaped thyroid gland can be seen at the levels of the C5, C6, C7, and T1 vertebrae. Its apex extends upward, its base lies at the level of the 5th and 6th tracheal rings, and its convex lateral surfaces are clearly visible. Parts of thyroid gland. The right and left lateral lobes of the thyroid gland are prominently displayed, joined in the midline by the isthmus. In the upper part of the isthmus, a pyramidal lobe directed towards the left can also be identified. Blood supply of thyroid gland. The superior thyroid artery, arising from the external carotid artery, is visible on both sides of the neck. Each artery divides into anterior and posterior branches at the apex of the lateral lobes. Venous drainage is equally well defined, showing the superior, middle, and inferior thyroid veins converging into the internal jugular vein. Thank you for listening to this module. See you in the next video.